So tell me if this sounds familiar. You're working in the pharmacy, grinding away, but you don't really know if this is the right path for you. Well, this video is for you. I get it. I honestly do. Look, we've all been there when you're studying, working, or you're just doing your own thing, and your mind is racing with thoughts, opinions, and hesitation. I was just the same, trust me. When I was in the midst of my study, I was so unsure of myself, my career choices, whether this is even the right path I wanted to travel down. So, how do you get yourself out of this situation? So what I've done personally is I had to reach out to every single pharmacy contact I could think of, whether it be a pharmacy owner, HMR pharmacist, hospital pharmacist, or even pharmaceutical reps. So you name it, I called them, I emailed them, I annoyed as many people as I possibly could. Now, the main goal here is that you need to figure out what are the main differences between the varying different types of pharmacy in Australia in general. Now, today we'll just jump into the main two. We hospital pharmacy and, of course, community pharmacy, the most common two sort of realms of pharmacy in Australia. Now, let's jump into community pharmacy together now. So this is the most common sort of career path you can take when it comes to pharmacy in Australia. The entire foundation surrounding community pharmacy is to establish healthy and productive relationships with your patients and with the doctors in the local community. Now, you will become the primary point of call and contact when it comes to all things relating to health and wellness. So as a pharmacist, in the community, you need to be really well armed and actually very equipped with sound and exceptional knowledge in not just the over-the-counter things, but also for primary care solutions. So in a situation, you could have a concerned parent with their child has a cold, or a patient needs help with wound dressing post-surgery, or you have an elderly patient that's struggling with fatigue. You need to have the solutions and those protocols ready to go at a moment's notice. And they need to be tailored for each situation. There is no such thing as a cookie cutter interaction in the community pharmacy world. Now, another thing that's also very, very important when it comes to community pharmacy is the concept of education. So when a patient comes into the pharmacy with a new medication, most of them generally will have no, solid idea of how the medication works, what the medication is actually for, and how to take the medicine and what to watch out for with the medicine as well. So ultimately, at the end of the day, us as community pharmacists, our main goal here would be for improving health literacy in the community. Now, health literacy is a massive thing that is really understated and needs to be sort of brought to the focus or brought into the spotlight in this day and age. Because I've seen it time and time again when you have a patient coming in getting one thing, and then you, after asking some very basic, information gathering questions, you discover that they're really not taking the medication properly at all, or even taking the right medicine to start with. Just imagine this, a patient named Sharon comes into the pharmacy and she's got a blistering headache for the last week. She comes to the pharmacy holding a box of paracetamol in her hands, asking if that will help. Now, hearing that just off face value, anyone would be like, okay, paracetamol, headache, it should work, it should do the job, and then they probably leave it at that. But what you should be really doing as a community pharmacist is by using that power of simple information gathering and establishing a rapport with the patient, you realize that Sharon actually has already been taking cold and flu medicine that already has paracetamol in there based off the recommendation of her next door neighbor. So little did she know that she was just about to double dose on paracetamol this whole time. Now, that's the power of community pharmacy, and you will get interactions like this on a daily basis where something as simple as a headache and paracetamol will end up to be something much more sort of, important and rather integral in terms of intervening straight away and giving the patient a real proper solution. And not just that, but educating them on where they went wrong and why they went wrong and how to grow from there. Now, these are really, really powerful skills that need to be developed, and the only way they can really be developed in the real world is through experience and practice and actually putting yourself in that position. These kind of skills you can't develop from a textbook, you can't develop from a lecture. It needs to be done in real world interactions. So the main three skills I always recommend when it comes to community pharmacy, I usually summarize them as the three C's. It's confidence, clarity, and compassion. So confidence in the sense that you're confident in your decision making, putting the patient's health and well-being first, and making clear, sort of confident and sort of decisive decisions in order to put their health forward. Now, this next C is clarity. So clarity in the sense that, when you're delivering your counseling, when you're speaking to patients, you need to be an effective and clear communicator, not to confuse patients with too much jargon, not to not deliver the correct information without sort of confusing the patient, but ultimately trying to ensure that they're getting the most out of their time with you and to leave the pharmacy more knowledgeable. Your job is to make them more confident in themselves. And by being clear in your speech, will make the world of difference. Now, the last thing that's also very important is compassion. So being compassionate in the sense that, the patients are coming out of their way to the community pharmacy, not because they're bored or have nothing better to do, but because they're unwell, they're upset, something's not going on, something's not right rather for themselves or for someone they love or they care about. So they're coming to you for advice, tailored advice. So I've seen one too many pharmacists nowadays, they seem to forget that aspect of pharmacy, that the patients that are coming in, they're not coming to buy as like a transaction, like you're going to another retail store. They're coming to the pharmacy because they want you as a pharmacist, the medicines professional, to have a chat with them and really make the difference and educate them in terms of how they're taking their medications or how they could be improving their health outcomes. Now, you've got to really put things into perspective, and I understand pharmacies can be quite busy, but we need to take the time to really sort of take a step back and sort of have a different perspective of things. It really, because ideally our goal is to inspire, to motivate, and to be valuable and sort of allow our patients to leave feeling inspired and feeling motivated to improve their health outcomes. Now, in terms of the next really massive aspect of community or pharmacy in general in Australia is hospital pharmacy. So hospital pharmacy is a completely different animal when it comes to how you can really define what a pharmacist is. In terms of hospital pharmacy, you're essentially the medications mediator and the medicines management expert of the hospital. So your main jobs as a hospital pharmacist, is facilitate accurate information gathering and concrete medication histories being recorded from newly admitted and current patients in the hospital. Your other primary goal is to, of course, to monitor the changes and the recommendations for patients from the doctors in the wards and to ensure that it's appropriate. And thirdly is to make sure you're delivering a safe and adequate supply of medications and counselling to those patients, on discharge or throughout their stay in hospital. Now, this area of pharmacy is very unique in the sense that it really does invite you to be more clinically focused in the sense of, you're communicating on a different level in the sense that in community pharmacy, the goal is to communicate complex content and jargon into a more simplified and a more digestible format. Whereas in hospital pharmacy, your main communication is between other healthcare professionals. So your expectation is to be delivering clinical content and knowledge to other staff members that are still fully aware and fully comprehending of what you're saying. So the level of detail and the level of clinical sort of analysis needs to be on a much higher level. Now, ultimately, another aspect as well that's also very, very important is it allows you to act as a sort of a team with yourself, the doctors and the nurses and all the other allied health to really make sure that the patient is taken care of the most holistically. And of course, that includes pharmacological and also your non-pharmacological therapies, whether it be physio or be any sort of alternative therapy as well. Now, generally speaking, this is a sort of abbreviated, summarized version of what pharmacy is in Australia. I will hopefully release a little bit more about, what the differences are in the nitty gritty in terms of industry, in terms of working for pharmaceutical companies, in terms of different aspects of community in a hospital. But just to get your bearings, I think this is a very, very good summary of what to really get your head around what is pharmacy. Now, there's no point of really knowing what the differences between these two different facets of pharmacy without having something that's very, very important. And that is an intention, a why. So by knowing why you're going into pharmacy or why you've decided to choose a certain aspect of pharmacy, you need to set yourself an intention. So you need to tell yourself, why am I clocking into work every day? Why am I going out of my way to learn a certain topic or a certain area? Now, you need to sit down, honestly, think about what are your goals, what are your outcomes, what motivates you? Is it satisfaction? Is it location, promotion aspects? Some people it could be even money, travel. So you've got to be realistic with yourself and think, where do I see myself in the next 5-10 years? And there's nothing wrong with switching paths in that sense, if flipping from hospital to community or the other way around, as long as you find something that is satisfying and allows you to be the best pharmacist you possibly can be. So you need to isolate your skills, isolate your talents, and see what kind of environment do you think you can grow the best in, definitely. So like what kind of problems can you solve? What kind of value can you provide to patients? What kind of legacy can you leave behind? Asking these questions really, really early on is very important because it allows you to write down a proper plan of attack and to know exactly which path to go down. And of course, always, always, always reach out to people who are ahead of you, your mentors, people that you think will give you the information or give you that sort of context and perspective that will help make your decision a little bit clearer. All right. So that's my sort of brief summary at the moment of, if you're feeling a bit lost in pharmacy, what should you be doing? Don't stress. Just get perspective, learn, ask for people who are more senior than you to learn from them as they have the most experience. So hopefully I wasn't helpful. Hopefully it was informational. Just hang around for our next release. So hopefully we'll go in a bit more detail about the nitty and gritty of pharmacy. Cheers.